Thank you for giving me the opportunity to present the Special Care Nursery's business planning framework for 2024-2025. So a little bit of background on our Special Care Nursery. We are funded for 3 cots and we've got the physical capacity of 7. We're classified as a level 4 on the CSCF, which means that we can take babies that are greater than 32 weeks gestation and greater than 1,500 grams. If babies are born before this time, we are able to stabilise these babies while we await retrieval services from Townsville. We've also got a 2-bedded boarding room where parents are invited to stay prior to being discharged home. Some of the achievements that we've had in 2023 shows that we're doing a pretty good job. We've got a stable nursing workforce with permanent staff. In February, we provided a place for an FYP, a first year of practice registered nurse. And this was really successful initially over and above my allotted FTE. The FYP moved into a permanent position when her 6 months of common came to an end. And then we took on a second FYP who is currently on a permanent contract in the nursery as well. The Special Care Nursery has supported staff going to Townsville Hospital to undergo CPAP training, and 3 of our experienced registered nurses went to assist Cairns Hospital in their staff shortage just before Christmas. So they provided a total of 6 weeks relief, which also gained a little bit of experience for them working in a busy neonatal unit. I attended Townsville on placement to work with neonatologists and fellow MPs and did some refresher training. And we also implemented a succession plan where in the last year, 2023, we've had one of the RNs being able to step up to the acting nurse unit manager position while I went on long service leave on 2 occasions. So our objectives for 24-25 are to continue doing what we've been doing, deliver great care at a level 4 service. We'd like to safeguard our babies, the families and the staff by providing a safe and quality service. We're going to continue conducting clinical audits to maintain clinical excellence and improve service, and also provide educational support in the Special Care Nursery to maintain and recruit appropriately skilled neonatal staff. So an audit on the CSCF version 3.2 shows 3 statements where we only partially meet. The most important of those 3 statements is where it is suggested that a minimum of 2 suitably qualified and experienced neonatal staff should be on duty when the nursery is occupied exclusively by infants that are requiring level 4 care. And the way we get around this is by the second part of the statement, which suggests delegated second nursing staff member is accessible to attend immediately when the unit is jointly located within a maternity ward, which we obviously are. Unfortunately, with an under-resourced and busy maternity ward, there's not always someone available to assist immediately. And when those people can come in to assist, they're not trained to administer CPAP, which makes it very difficult to stabilise neonates. I believe this could be mitigated by an implementation of more staff in the nursery and moving to 2 staff on each shift. The second statement that we partially meet is the fact that we do not currently report our data to the Australian and New Zealand Neonatal Network. Our membership was sought to be able to do this in October 2018, and this is currently ongoing. At present, we collect this data in hard copy, and it's all filed in the nursery at the moment, but ideally we need to get online with this, and I'd like to see this happen in 2024. The third partially met statement is the fact that we have not got a lactation consultant in the Northwest. I'm currently working with the midwifery educator to provide the nursery staff with more education around breastfeeding, and I also have 1 registered midwife as a staff member in the nursery that can also help. Neonatal services, including the holistic care of the neonate from admission to discharge, are provided by paediatricians, advanced trainees, neonatal nurse practitioner, resident medical officers and interns in the Northwest. This is done by daily ward rounds or more frequently as they're required. The causes of blindness that are avoidable and or treatable is retinopathy of prematurity. In the Northwest, a team of specially trained neonatal nurses are able to image neonates. We send these images to the ophthalmology team at the QCH review. This service is provided on a needs basis. Also, the Northwest has an allied health service team, which includes occupational therapists, dietitian, and speech therapists. These services are available on a referral process. So just on social and economic factors affecting the Northwest, we do have a fluctuating population, and there is a higher than average percentage of First Nations people. With specific relevance to the special care nursery, we've got a high risk of behaviours. So this includes undisclosed pregnancies, non-compliant gestational diabetes, high rate of failure to attend antenatal clinics, screenings and ultrasounds, and substance abuse in the form of alcohol and drugs. Access to services for our remote communities can be poor, and we have found that babies have been born before arrival in those communities. The strengths that were identified in 2023 is the fact that we have good evidence-based practice. We do this with the utilisation of the Queensland Maternity and Neonatal Statewide Guidelines. We've initiated and developed local policies and procedures and continue to do so. And we had 3 permanent special care nursery staff that were trained with scope for succession planning. Our weaknesses are predominantly linked to the lack of nursing staff. So we have no clinical nurse positions, and that does make succession planning difficult. We've got a lack of clinical facilitation or neonatal specific education. And we've got the inability to back transfer some babies from tertiary facilities just because of lack of funded beds and ultimately lack of staff. We've got inadequate storage in the nursery, so we haven't got the room for the cots and equipment, and we have no sterile storage space. We don't have an isolation room, which means that babies that are potentially infectious can't be looked after in the special care nursery. We have got the risk of staff burnout due to the requirement for overtime and extra shifts when we do have to support the level 4 status by putting extra staff on. And we have inadequate staff in accordance with the CSCF level 4. We don't have the ability to have 2 suitably qualified staff on each shift. And as discussed previously, the ability for a delegated second staff member from maternity. In 2024, we have got the opportunity to apply for the neonatal swim program through Townsville, and this has been encouraged through Townsville. I've got 1 staff member that needs to go this year to be trained up in CPAP training. Our threats are related to just the isolation of Mount Isa. So wet season flooding impacts our stores and supplies. And the isolation with flooding and inclement weather can also lead to longer than expected retrieval times for babies that we're trying to stabilise, which will impact on our workforce. Our operational plan for 24-25 is to provide high quality neonatal healthcare to the people of our region by enabling them to stay as close to home as possible. We wanted to continue to establish neonatal specific policies and procedures and ensure culturally safe and appropriate care is delivered to all neonates and their families. We're also going to continue to support and partner with local and Indigenous health services. The quality plan for 24-25 is to provide high quality, evidence-based, family-centred neonatal care in line with level 4 CSCF, which will result in optimal and safe outcomes for neonates and their families in the Northwest. In 2023, we had no SAC1 or SAC2 incidents. We had 7 SAC3 and 15 SAC4. All have been closed. We received 8 compliments and no complaints. In 2023, our daily average occupancy was 1.83, which was a slight increase from 2022, where it was 1.82. The average occupancy for the unit in 2023 was 61.29%. I guess that what I'd like to illustrate is the daily average occupancy does not account for acuity of the baby. And my estimation of 21% of admissions requiring respiratory support or a retrieval to a tertiary hospital means that we would need 2 staff assisting. In a bid to try and look at how I could increase the revenue in the special care nursery, I went back to the basics and looked at what my revenue actually was. And I found that historically neonates are being transferred to the maternity ward to board prior to separating from the hospital. And this was affecting where the revenue was assigned. So as you can see in 2021 and 2022, there's a massive difference to the actual revenue for 2023 when I started or stopped transferring patients out of the special care nursery. So in 2023, we have been discharging from the nursery home or separating from the nursery to home, and this has impacted our revenue to the tune of $1 million. I just wanted to try and illustrate that bed occupancy does not equal revenue. It's the acuity of the patient that equals the revenue. So as you can see on this slide, in May, we had 100% occupancy and our revenue was 112,000. But in June, we had nearly 99% occupancy, but the revenue was 260,000. Now, in June, we did have a 26-week gestation baby born who was stabilized and retrieved out, and our acuity was very high in June. Special care nursery ratios are the same for each shift. We have 3 shifts in the nursery in a 24-hour period, and it's 1 nurse to 4 patients. During the day, Monday to Friday, I'm also on the floor and classed as an extra nurse on the floor. So there's 2 people in the morning on those shifts. On the rest of the shifts, the girls are on their own. This ratios change if we have a baby that's either stable or unstable on CPAP or needs invasive ventilation. When this happens, we need to increase the staffing on the floor, and from a pool of 6 staff, it's very difficult to do that. It's achieved by using overtime and 12-hour shifts, which inadvertently leads to fatigue. Staffing profile for the special care nursery consists of 1 full-time nurse practitioner, and I currently have 5.8 full-time equivalent registered nurses. So as a nurse practitioner, my role is split into, I'm clinically, I work as part of the paediatric medical team, and it's suggested that my level of scope is that of a registrar. So I can admit, order diagnostic imaging, pathology, plan care, all under the admitting paediatrician. My procedural skills include inserting peripheral and central venous access, inserting umbilical, arterial and venous lines, intubating babies. I have limited experience on chest drain and needle decompression of pneumothorax, lumbar puncture, but I'm also a skilled ROP screener. I work closely with our tertiary facility in Townsville, and having done my internship in the Townsville neonatal unit, I have a good relationship with the neonatologist there. I'm able to discuss cases as and if required. I also provide education to medical staff in the form of advanced neonatal resuscitation and stabilization and surgical conditions of neonates. That is delivered on the monthly advanced neonatal resuscitation workshops, but I also do extra sessions with the interns and RMOs. As a manager for the special care nursery, my roles include pretty much everything. So I have no admin support, so I do all my own administration, my training and education, facilitation. I support the senior staff, I do the rostering, I make sure the quality and governance management is and policies procedures are up to date, and I cover staff deficits by working on the floor. My RN profile is somewhat limited in 2024 with the departure of one very experienced registered nurse. Now, these two positions were filled. Initially, the first one was filled with the FYP that joined us last year. So she's now 2 years in her second year of nursing. And the other position was filled with a first year practice registered nurse who does still require lots of support and training. I have two middle of the road registered nurses who have got experience in the neonatal unit, one who has actually worked in a acting capacity as the nurse unit manager while I've been on leave. And then I've got two registered nurses in the age category of 60 to 79, one who has suggested she may retire this year. Although not in my BPF, I did want to highlight the successful grant applications for 2023. I submitted 13 in total and was successful with all 13 to the tune of $104,779 of savings for the Northwest in equipment for the nursery. And finally, a proposed service improvement for 24-25. So I would like to see increased staffing, including a clinical nurse or facilitator, and increased bed capacity in the special care nursery. According to the Neonatal Workforce Project in 2020, Queensland Health's goals for families and newborns is that they receive safe and high quality care as close to home as is feasible. We'd be able to do a much better job of this with more staff in the nursery. While I realise that increasing my FTE is a substantial amount of money, I would like to ask if I can put a business case in to support this project. But in the interim, it would be highly beneficial to increase the FTE in the nursery just by 2 RNs at this stage, enabling me to be able to provide safer management for neonates while a business case is prepared. Thanks very much for your time.